Okay, gentlemen, we are live.
Good afternoon, everybody, and welcome to the March 14th workshop of the Board of County Commissioners. Would you all please rise for the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, the first thing we have on our agenda for discussion today is House Bill 21-1085 as it reflects the rules pertaining and securing transportation of patients in behavioral health crisis. So, Haley,
We got a room full.
I know, I'm looking around, I'm like,
So
You guys are gonna have
I'd
to-
like to introduce the topic quickly, if I may, Chairman, and talk about why I asked for this meeting. First of all, I think transportation of patients experiencing behavioral health crises is an issue and continues to be an issue for all agencies. One of the issues that this bill was meant to address is to get those agencies that are transporting reimbursed, and so I think it does part of that. Some of the other things it does is that it puts the licensure burden onto the counties, and while we definitely prefer local instead of state control, the way this currently exists, as I read it, is as an unfunded mandate unless someone here is aware of funding coming down for this that I'm not aware of. And I'm seeing from public health that I don't think they're aware of any funding coming down to pay for this. So all things that need to be discussed today. And I'd like to give a synopsis to the commissioners, and then we can ask questions or get input from those who are participating. Commissioners, you all have a hard copy in front of you, and there are extra hard copies on the table if anybody wants them. But on page 3, capital letter D, line 93, says secure transportation does not include urgent transportation services provided by law enforcement or personnel employed by or contracted with a law enforcement agency to individuals experiencing a behavioral health crisis. And then on page 4, line 116, capital letter A, it goes on to say, except as provided in part 3.2 of these rules, no secure transportation service, and I've got to admit someone on Zoom real quick, I apologize.
so before we get too in-depth with this, I have to ask you the question. This bill was passed last year.
Correct, and these are the rules that are coming out that counties are responsible to enact by January 1st of next year.
So,
And that being said, HIGPUF isn't required under this to have their part done until June of next year. So I don't know what it's going to look like with us getting ahead of HIGPUF, but that's a part of it that the commissioners need to be aware of as well. So I'll continue on page 4 there. No secure transportation service, public or private, shall transport a person experiencing a behavioral health crisis from any point within Colorado to any point within or outside Colorado unless that secure transportation service holds a valid license and permits issued by the county or counties in which the secure transportation service is based. So a couple of items that I want to speak to quickly there is when our community intervention program gets off the up and going, it certainly would sound like that they would be subject to these licensing requirements. And then it also sounds like if anybody was using, say, Cortez cab or somebody like that to get transported, those cabs or whoever was doing the transporting would then also presumably fall under these licensing regulations. Continuing under 3.2, it gives county exemptions. Like we said, licensed ambulance agencies are number 1, and number 4 is law enforcement. It clarifies under B that a licensed ambulance agency that is exempt from additional secure transportation licensing requirements is eligible to receive reimbursement. I think that's a piece that is probably what this whole thing was designed around, because, correct me if I'm wrong, Scott, but previously you weren't getting paid for transport.
Correct.
Okay. And then under 3.3A, line 146, county shall adopt and periodically review by resolution or regulations requirements for licensure of sector transportation services. The license requirements shall include, and then the following. It does allow us to charge an application fee, but there, as far as I'm aware, and public health can correct me on this if I'm wrong, we have not been advised to the state of any funds coming down to develop all this licensing, have we?
You want me up here, or can I just talk to them?
You do need to use the mic, but I don't care where you use it from.
Okay. So we do, Dr. Aikin, our medical officer, goes through and approves the ambulances that we are used. As Laurel and I were looking at this, we're thinking this is just one more vehicle, thinking the CIP vehicle that would fall under that. That's what when we were looking at this, that's what we were figuring. It would
So you
just be
think
one more.
you would license it the same way as an ambulance?
I haven't talked to Dr. Aikin as, on this particular vehicle, that's what we were thinking, but we might be completely out of the ballpark. I'll step aside.
I would think that an ambulance, whether it be ALS or BLS, is going to be licensed totally differently than this is nothing more than a transport vehicle. So there is
Yeah.
there is
If it was an
provision for
ambulance, it would be
just
exempt.
transport vehicles. Southwest has transport vehicles that are not ALS or BLS certified. So I kind of agree with Bobby. There's going to be a difference between the certification of the licensure of the transport capability, and this would fall at the lowest point of just a transport vehicle.
Right.
Correct? So,
Yeah, again, I'm not an expert, and I don't think the Department of Health regulations have all been worked out, but it sounded to me from the things that I was looking at that a lot of the part of licensure has to do with the training of the personnel. And you want somebody who understands, how to de-escalate verbally if somebody's out of control or abusive. You want somebody who understands what the right ways to use of the variety of restraints are if the person needed to be restrained. I mean, it's really, the vehicle to me was probably not going to be equipped very much different than some of our transport vehicles that we might already have in EMS, and it was really making sure that the people who did the actual transport were aware of how to handle the patient, depending on the circumstances of the patient.
That's one piece, yeah.
Yeah.
okay.
So it wouldn't be exactly the same as licensing an ambulance?
It,
It seems that it could be under that umbrella.
Okay.
If you had the right training, it could be just.
which is the purpose for the EMTB and the clinician on the transport vehicle? Because you actually have people that are trained
The EMT portion, yeah.
to de-escalate or defuse.
At the meeting that I was at last week, they were not requiring it to be in the, so they were saying you could build one-on-one, which means you could have the person in the back and the driver and that person to do it.
Oh,
Mental health. So there's two different types. If they use one person driving and one person in the back with the patient, that's different. So they were not requiring the designated to be driving the vehicle. That would be under our discretion if that's what you want to do.
Did they have any qualifications for those people in those vehicles?
They were looking at this.
Scott, I'm going to ask you to come up to the mic because we'll get a lot of people that can't hear you. sorry.
They were looking at that, not just to be, here you go. Not just to be an EMT. So, and that there was still, they had done a lot of changes on this, and they were taking it back and revising it, so it's not for certain that what the requirements are really going to be. The whole purpose of this meeting was, on Monday during the web meeting, was to look over the definitions and what they feel that is a requirement that the vehicle must have. And that's what some of these were in here. So they're still not, because they are letting security in Denver take mental health patients from point A to point B, but that's in Denver.
Sure.
That's across the street.
And that's, yeah,
Yeah.
say 10 blocks away.
Right, right. And they didn't require any type of medication or any other type of, for a medical need. So that's what that was all about.
Okay.
So they're still in process of formalizing this. Now, we do have as far as licensors go, the EMS Council is the advisory board for the county commissioners for licensing and to inspection to see if it meets the qualifications. Until this is confirmed, and they've come with a final format, then we can look at all that and see how we're going to proceed with this. Because I know it's going to go right on through, and it's for sure thing. So they're just looking at how they're going to make a state requirement for each vehicle, and for who's driving the vehicle, whatever, what is needed as a certification.
So it could be at the very lowest tier then, if
It could,
if you're saying what they're doing in the front range is just a security guy just driving it
Yeah,
one-to-one. I mean, that's
yeah, they're finding that
pretty
it's
simple.
a lot of these transports don't require
Right.
an ambulance.
Absolutely. They just need to transport from A to B to get to the help where they need to be, which is over here on B. Okay.
Yes.
So it's, I guess I look at it as, until we get the actual final definitions back, it's going to be nothing more than just a transport of A to B.
That's it.
Well, that's what it's talking about, is transport from anywhere in Colorado to anywhere within or without of the state would be subject to this licensure. And you're right, it wouldn't have to be an ambulance, but it would now have to meet all these requirements.
Which
So-
still then falls back under the same criteria that we currently use to license our ambulances that we
Correct.
do right now.
But some of the things that don't fall under our current licensure right now is like if Moco or Cortez Cab or somebody wanted to transport somebody.
Correct.
Right now, they could do that.
Yes. Yeah, they could.
Go ahead.
And I think that raises issues anyways. I mean, I don't know whether that's.
You would have to have
But
training.
how are you going to, I mean, they could be transporting somebody right now with behavioral health issues. How would we ever know that?
Well, and now once this goes into effect, then we are responsible to know that and to license that.
Yeah.
I'm confused. I think, are we overthinking this here, or?
And again, my interpretation of this is that we're talking about transporting from one facility to another.
Right.
I mean, if somebody decided they were walking down the street and wanted to go to a mental health facility, they'd get in a cab and this wouldn't apply. But
Correct.
if we have somebody that comes to one of our local healthcare facilities and is determined that they need to go to a different facility for their behavioral health care, then according to how I read this, it would need to be a licensed transport vehicle and staff that took them. That would be the big change.
I think the biggest reason they want a licensed vehicle is that it meets the requirements. So the patient is securely and safely transported to another facility.
And I think Haley could comment on this, but my experience has been that many of these people actually are willing to go voluntarily after they have been evaluated by a behavioral health provider at the first facility. And so then it's just a question of how do you get that person, and sometimes the transport is a fair amount of distance. I mean, at this point, it would be mostly going to Durango, but sometimes it's much further than that over on the Front Range, so.
8 hours.
Yeah, we could be 4 to 8 hours
Yeah.
away.
Yeah, and most of the time, our guys are going for 8 hours at a time, and so they're driving right back, that's 16 hours. I mean, it's quite a far distance. We would change some of the criteria since they're in a smaller vehicle, and they can do a little bit faster turnaround, but in an ambulance, requiring an ambulance for some of these transports is really, it's toasting it. I mean, we have an ambulance that 2017 already has over 100,000 miles on it.
Yeah, and I don't think that's the intent of
Yeah.
the language at all. I think we can use a transport vehicle that's not.
If it doesn't require it, yeah.
Yeah, it's pretty clear that unless it's a patrol vehicle or an ambulance, that it would be falling under the licensure here. The ambulance is already exempt,
Exactly.
Right.
so the ambulance and the sheriff's vehicles are already exempt from this.
So what do you need from us then, or more than just to bring it to our attention, because it's going to fall under the criteria of the licensure that we already performed?
Well, it's going to be extra licensure, and I need to know from public health, is this going to be completely separate and in addition to all the ambulance licensing that is already done, or is this going to be more staff time, coming up with more regulations, et cetera, et cetera?
If we're just talking about the CIP vehicle, I don't
Well,
think.
it would be
well, the-
anybody that wants to transport.
Well,
in the
and this
county.
is where it could potentially become more, because this also would take our medical officer's time to do this role. Because the person, say for instance, MoCo wanted to apply, they would have to do an application, try to meet the criteria. If they're going to be transporting individuals who are of behavioral health needs, then they would have to apply to be one of those approved vehicles.
And
That's how I see
accepted.
that. And accepted
And
by
then we
our
would
medical officer,
license
and then they
them.
would be licensed, right?
So it could be, the potential is there, but I would. other
I don't know
than
how many
maybe
vehicles we're
local-
talking about, you know, I mean, I don't really have an idea how many vehicles we're talking about here, so.
Right.
But thinking about the CIP, I don't see that as being an issue,
Right,
'cause it's
and
literally
to-
one more rig.
To be perfectly clear, CIP wants to stay within the county as much as possible and not be a long-range transporter, but I can certainly see instances in which they might want to transport to Crossroads or to, what's the other part of that? Well, I guess the whole thing is called Crossroads.
Yeah.
Yeah, and I mean, it's better to be prepared than to need it and not be prepared. So I think that having them properly certified is what we want to do for the CIP. It's just, it's the other vehicles, I'm not, you know, they would have to go through the process if they want to transport, according to this new bill, that they would have to go through.
The first year it could be nobody, the second year it could be one or two maybe, potentially, and, I mean, it could be a handful.
Well, I have to say that a lot of these have to have the radio equipment
Correct.
in there, so they can call, and that they have a distress call. So, again, I express that anybody that wants to do these transports that meets the EMS council would be the advisory board for the commissioners to see that, yeah, we feel that they could meet those requirements, and that they're willing to do those requirements, and that they would train their staff for de-escalation.
I mean, just listening to this conversation, I would almost bet you that we're gonna have one, and it's gonna be the CIP van or vehicle.
And us.
Well, and, I mean,
Access
but you guys
separate.
are already dealing with behavioral health, so well, your vehicle would also be licensed under that.
Yeah, community behavioral health centers were not exempted in this, and so we would also need to be licensing Axis or at least Cortez Integrated Health. And it says out of the county in which they're based. Are you currently based out of Montezuma County, or are you based, air quotes, out of 11 counties?
I think it would depend because it's not specific, you know, because the cars that are based here, would they have to be based out of Montezuma County? Because we have some in La Plata County, a couple in Dolores, so that's what was kind of unclear if it was where the organization was based, because then they would all be licensed out of La Plata County, or if it's their origination place.
Yeah.
So, and I think for us, we'll do whatever we need to do and follow whatever licensing requirements, but if CMHCs could be exempt, that would be helpful, because we do a lot of problem-solving transports between locations, short distances to the ATU, those kind of things, with our crisis staff and other staff members. So all of those people would have to be licensed, and those vehicles would have to be underneath this umbrella as well. And the additional reporting, I think, is what we worry a little bit about.
I would almost think that it's going to be, it would fall under La Plata County if that's actually where your home base is at. It's probably going to fall under there. And then where you move your vehicles at that point in time, I don't think it matters. It's still within the state of Colorado.
Yeah.
I think we'd need clarification from the attorney for sure before we made that call, though.
Yeah, well, and this is still all somewhat in the early stages.
Yeah, it's
So,
brand
I mean,
new.
until we get something that's hard and fast, I mean, we're kind of shooting at a moving target at this point.
Yeah.
Mm-hmm.
So just
Okay.
to have some clarity around that would be great, because then we don't know, do we report, if it's La Plata, then we report to them? You know, you wouldn't have a lot of visibility on that data if it all goes through them. So, yeah, like I said, we'll do whatever we need to do, but it's a lot of additional admin burden for us. We'd probably have to hire another person. That's what we think.
And then, Commissioner, so I want to bring up one other instance where this may apply, and I don't know that it would apply so much now, but our Veterans Service Office has used their own vehicles to transport people that were somewhat in behavioral health crisis from here to the VA in Grand Junction. And
I think you're going to convolute those.
Yeah.
Don't mix those up, because Veteran Services is something totally specific. Those veterans are going to get the help they need. It doesn't matter what circumstance they're in. So I don't think they're going to cross at all.
But I think that that's a volunteer deal, and the veterans offer that transportation, like, if you want to go, guy, we'll go. And those vehicles are there for doctor's offices or whatever, and if they say they want to go to Grand Junction to the VA hospital, whatever, they can get in the car and go. And they're not committed, they're not a referral from a physician that they go to these facilities. So it's an all-volunteer thing. So they could go in by private car if they wanted to, so. and that's
Two totally different things is the way I see that.
okay.
That's just my assumption. I mean,
Yeah, because the hospitals never called them to ask them to transport for mental health at all.
Right.
I think once somebody calls them and they're in a facility, that takes them to a whole new level.
Right.
correct.
Okay, fair enough. So
Okay.
I guess our duty is just to make sure how much administrative burden and extra cost is going to be associated with this once it comes down, because we definitely prefer local over state control on something like
Absolutely,
this,
and I
but-
don't want to give anything back to the state at all, because I think then we're going backward. I mean, for the last 2 years, I being one of them, is complaining about giving us back our local control. And if it's just licensing one vehicle as a transport, I don't think that's going to take a lot of staff time.
Yeah.
So
I
don't-
would say that, well, in the rest of our areas, I guess do we do the licensing for Dolores County too? No, they do their own. But then San Juan Basin Public Health would do Archuleta, La Plata, and San Juan, I would
think-
assume,
I think they cover them, yeah.
at the moment. I guess the other thing just to be cognizant of is for our behavioral health providers that, you know, to the extent possible, we should work on reciprocity with the other agencies to try to keep our behavioral health providers from having to meet 5 different standards in 5 different counties. Just as a courtesy, I would think that we should work on reciprocity agreements.
I think that when they get all of the rules established, it is going to have reciprocity, and there's no way that they can't with 64 counties in the state of Colorado, and every rural county at some point in time may end up in the Front Range. It's like any other bill, they're gonna have to have it in there.
Or they could be here.
Yeah.
Well, that's true. Could be here.
One of my concerns is crossing state lines. 'Cause during the winter highway time is, for these guys to go some of those passes is tough.
I don't know that this addresses anything about
don't think so.
crossing state lines.
It was brought up at the meeting.
Oh,
It was brought up because they're close to Kansas and
Right.
and Wyoming, yeah. They did bring that up, and they're working on that, so that was kind of iffy. They were
do you know
trying to
which
figure that out.
direction that's heading? Because obviously, there's times if you wanted to go to Junction where Moab would be safer.
Oh, if we cross state lines going during the transport, our destination is within the state, we're okay.
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 Because as long as that person is within our vehicle, we're following our protocols, way our position wants us to operate, and the county's licensors. If we were to drop them off at Moab, it would still be okay, but as far as going across county lines, you're in the state of Colorado as far as the ambulance goes, you're pretty safe. So we don't have to follow any different rules just because we go in a different state. As long as they stay in our ambulance, that's all it is. For us to act, if I was to go Moab at Easter Safari, I can't practice the same as I can in Colorado in the state of Utah.
Right.
So that's all that is.
Any other questions or information for us?
Anything else the commissioners should consider for giving him feedback?
Okay.
Shelly, do you have anything to add to this?
Yeah, thanks, Jack. I just tried to raise my hand. I wasn't sure if you could see it. I think that, I think there are a couple high-level things that I think are important to consider, because I think that nobody would argue with the interest of having safe transport for people with behavioral health needs. I think that's an important thing for the state to regulate. But I have concerns for the counties and in terms of the amount of burden, because, yeah, I couldn't hear quite all the dialogue, but reciprocity across county lines is a concern for us. I'm going to hope that we don't have to be registered in every county to qualify to move people, because we do move people as well, whether we're considered to be secure transport or not. We do quite a bit of transportation across our region, so I would worry about that. I'm concerned that mental health centers aren't exempted from this, and in rural environments, that seems to be a miss with this legislation, and I don't know that that can be fixed in the rulemaking piece of it. But I do think there are some real hot spots in terms of burden, and I think if this is intended to be a way to make things safer, that's one intention. If this is a way to make it clear how other entities could get into this business, I don't see a lot of people getting into this business. So what I don't want to have the rulemaking do is impair the things that are working well locally that we've figured out, and I think that's always a risk when we get into these very in-depth rulemaking processes with the state who doesn't really understand our region. So I would just say that for what it's worth.
Okay. Very good. Thank you, Shelley. I don't have any other questions. I think we just have to kind of wait to see what they come out with their final rule now and see how it plays out. And then, I mean, a lot of it, as far as staff time, the state is paying for 100% of public health right now anyway. So we're going to bill it right back to them. We get that. We're getting that back anyway. Correct? I mean, well, as of today, as
Sort
of
of.
right now, that's the way it is. Yeah, I mean, anything can change through that process. But right now, I mean, if they feel that it's going to require that much more staff time, is all we have to do is request it.
So it sounds like maybe at least 2, CIP and then Access.
On the access, yeah.
So,
And that could all actually end up being taking place in La Plata County.
well, CIP wouldn't.
No, CIP here, but access could be in the Plata County. Okay,
All right.
all right. Thank you, guys.
Thank you, gentlemen. Ladies?
Okay, next we're gonna move on to our Southwest Ambulance Fire Protection District. So, whoever, I guess the Fire Protection Districts, if you guys wanna come forward. And we'll talk about the PSST. And there are two mics. If you all gonna sit there, grab that other mic and just
Yeah.
pull it down there.
Grab
That
you a
way
chair,
can-
Tony.
So who are we missing? Nobody. Everybody's here?
Louis Ariola.
Okay.
Missing George. I hope he's not busy again.
He is.
Okay. Well, we'll go ahead with it. So I will open the floor to you all.
I guess I'll go first, since it feels like everybody's looking at me to start the process. So, as you know, we came to the commissioners, I believe a couple times, a month ago and probably up to 2 months ago, and made a presentation with a PowerPoint articulating articulating our financial issues at the Cortez Fire Protection District, and that we're about 1.1 million short of where we need to be be able to continue moving forward at a rate that will replace equipment, and hopefully we can stop a little bit of the open door, revolving door we have with firefighters going to other locations to make, you know, $10,000, $15,000, $20,000 a year more. So ours is a really a 50-50 deal, if you will, or maybe more like a 40-60, as far as 60% being wages and staffing. We're short-staffed as well, and then the other 40% is capital and the ability to replace equipment at a pace that would be able to keep up with the equipment that we currently have that's becoming outdated.
And so it came up from the commission, when they approached this, the commission's very strongly considering the sales tax as a public safety sales tax. And it would be very difficult to include one fire protection district without extending
Which-
the olive branch to everybody, which brings us
Which we
to
have
where
already
we are
said
here
that if it's
today.
in Montezuma County, it has to be to all 5 fire districts. It can't be to one or the other, because obviously we are all Montezuma County. So that's what we look at. I will go back to, you know, Jay, your presentation. Thank you for that. Just looking at the number of calls per each district, like Pleasantview, you know, is very, very, very minimal. Dolores, yours, I mean, I can't remember how it was ranked, but then they would go incrementally based on that. And I think, I'm assuming you guys have all had that conversation.
We've not had a chance to have that conversation because we were still trying. I was waiting to see kind of where things landed with y'all, to see, or what you're thinking anyway, before, because I didn't want to make speculation until we had something a little more
So then-
tangible to work
And I
with.
called for
I won't
this so that we could
necessarily-
ask what the other fire protection districts' needs are at this point.
Spill any of the information there. I mean, I'm gonna let you guys get with Jay, and you can look at their presentation that was presented to us. But we discussed it last week, and we've actually discussed it with our attorney of what is the best option for us to go for a PSST or an actual general sales tax. And correct me if I'm wrong, gentlemen, but we are leaning more towards right now the PSST. because our law enforcement, our jail, everything else that we are working within that, those are probably our biggest gaps that we're going to see in the next several years, because the sheriff has had the same presentation to us more than once. I've seen it, I think, I've seen it for 3 years now that I've been here. You know, we're continuing to be a playground of, and I understand it, you know, you get trained a little bit, you get a few years of experience under your belt, and you move on. And we're struggling with that, and I think we're going to continue to struggle with inflation costs going on. So I think we've asked the sheriff at our last meeting to give us some real numbers, because these have to be, number one, we don't want to overtax anybody, and we want to tell the people when we go for this, we're going to spend it on X, Y, and Z, and it's going to cost us A, B, C. So the sheriff is going to have some numbers together for us for the needs of the county and what we have to have, and then it's going to be a matter of how do we slice the pie.
And so we'd like to, you know, hear a little bit from your initial thoughts of what the needs of your fire protection districts are. And since we're live streaming, I'm hearing a lot of people complaining about the price of fuel. I just want to give a shout out to all the people who voluntarily pay $4.25 a gallon to jump in their car and go to someone else's emergency, because the majority of our county is covered by volunteer fire protection districts, and so they're paying that on behalf of someone else's emergency. So I'd like to thank all the volunteers out there, and then hear from you as to what your projected needs might be.
So, Mike, since you're next, we'll just go right down the line. Mike, Tony, and
what Dolores is kind of looking at is, you know, we're a small rural area where we just have a limited amount of volunteers. Well, nobody works in that area. So in the daytimes, we don't have people to run. You know, a lot of times I run calls by myself. So we were looking at if we could get some of that money, we might be able to pay a few people, at least one or two, to cover during the daytimes, during the week when everybody's working. Because this day and age, you know, the young guys, we say they don't have any dedication, but they do. They're just overwhelmed. It costs them too much, and a lot of employers won't let them off work now. And when they do, they dock their pay. So it's hard, you know, for them to make a living and then have to do that and lose pay, plus buy the gas, like Shaq was saying. Money's getting to be a big burden as far as that goes for volunteer firefighters. And if you look nationwide, it's a nationwide problem. It's going downhill. So we got to start looking to the future to do something, and that was kind of what we talked about with my board, is maybe trying to pay one or two people during the week to cover the calls.
okay.
You can use 2 mics.
Well, I have to agree with Mike on the daytime stuff from, you know, from 8 to 5, Monday through Friday, is just becoming really difficult. I've got one member that works right there in town and lives there, and he's almost by himself most of the time. Everybody else works out of the district. And then, of course, you have the issue of trying to keep your trucks and equipment updated. And we struggle to get grants. We don't know the right terminology, I guess, to put in those narratives. We're just not there compared to these $1 million departments that, I guess they need the money as bad as we do. They just got a lot bigger budget, and they can pay somebody to write the grants for them. But kind of where we're at.
Okay, Angela.
So actually, Pleasantview Fire is actually sitting pretty good, so don't, I'm all supportive of a county tax for these guys, but Pleasantview Fire is sitting really good with the revenues we get, and the small percentage, we would get a small piece of the pie, which would help us in some ways, but we do have a couple trucks we need to replace in the next 3 years, but other than that, we don't really have any needs. So.
Southwest Ambulance,
Yeah.
you'll need a mic.
I just, I'm solely. I just-
Well, you need a mic for YouTube.
Sorry. So anyway, I solely support volunteers. I came from volunteers. And I think it's a great thing that you're going to do, or if you can do it. And the struggles of trying to replace equipment and the prices that are going up, I mean, it's tough for the volunteer departments. They work with a very little mill levy. We, at Southwest Memorial, the ambulance, the EMS part of it, we'd like to be included in your text. And the reason is because we would like to get trucks in the different locations to best serve the community. And we're working on a budget that just is right there. If we're still with them, you know, we're still an ambulance that operates out of the hospital, and the hospital does pay that surge what we don't bring in, and sometimes we don't bring in very much. But we also, if, say, SHS was ever to go, we're still under MCHD and in the county, so I'm just bringing that little point up. But we would like to, there's a lot of transports out of the area, a lot of transports going to Durango, Grand Junction, and all that, so our trucks are getting a lot of mileage on them, and so it's a good thing that there is a state grant system to help pay for that stuff as far as replacements costs. But we would like to see a branch of another station in a different location, and I don't think we're ever going to get there under the current situations that we're in right now for the next 3 or 4 years. So that would help quite a bit.
Where are you currently at right now, or is everything housed at the hospital? Question one, and then question two is to the attorney, because our ambulances, can they be included in a PSST? I never saw that statute said that.
Yeah, I think the statute's more along the lines of public safety type stuff, and so I'm not really sure that ambulances fit within it. I didn't see a specific reference to it in the statute.
We'll obviously have to research that, Scott, because looking through the statutes, when I read it, they're excluded because they usually fall under, obviously, SHS or the sales tax that you guys currently have.
Yeah.
I'm assuming now.
Okay.
I don't know how they split those dollars up, but I didn't see that within the statute that they could be included.
Okay.
But he has a law degree, not me.
Yeah. Well, we didn't know where that was going to go. Is that we just feel that there's, I think the doctor agrees with me, that we really definitely need another truck up there north. When we had one in Dolores, it really helped the situation as far as covering a large amount of area.
Sure.
So, yeah, we have an ambulance in Mancos, and we stationed 2 in Cortez because of the high volume in Cortez. But getting one up north just cuts down the response times.
Absolutely.
So it helps us out.
Okay. Questions, Commissioners?
Shaq, you might know this. We're talking public safety. Is USAR and K-9 fall underneath there? I'm just spitballing here.
I can look at that other statute.
And so I'm looking at the statute right now, and it talks about entities that are dedicated to providing services related to public safety, public health, or emergency management. Certainly an EMS district would fall under that public health diagnosis or emergency management.
But you're not set up as a special district just for the ambulance, correct? Well,
They're the redheaded stepchild out there.
I'd have to just redefine that. I mean, I'd have to look into that. We cover Montezuma County, and that's it. Or wherever, we go wherever we're asked, and that's a state law. It's wherever you're asked to go, you go.
correct, but I guess what I'm getting at is you can't have 2 different sales taxes. So MCHD has a sales tax right now. So you can't double dip. You can't say, hey, we're going to take from this one and this one and this one.
Yeah.
We can't do that.
Understood.
So we can incorporate the fire because there is nothing that they have as a special district. However, MCHD, they
Does
have a tax.
MCHD
That's true.
contribute to the ambulance? Or do you know?
It's for
For the property?
note, which includes the EMS.
Okay.
We're still,
They're going back to the lowers again.
Because Southwest Memorial and
So
MCHD
here-
are
here's-
technically separate,
Yeah.
but interwoven.
But technically, we're, like, our building belongs to MCHD.
Yep.
And those ambulances, really, they have SHS on the side of it, but they're MCs.
They're-
They're basically the county. They're the
Right,
county.
the hospital district. Right.
Clear as mud.
So that's why I'm a little reluctant to say anything as far as that.
Yeah, I
Because I
think-
think they're going to be, they fall under something totally different that's already existing.
Okay.
But we need to look, because
I'll-
these guys are.
I'll continue to look at it.
Yeah.
I kind of tend to have the same thought that since you guys are your own district and you have your own sales tax, I don't know that we can double dip, but I'll look into it and see.
That's, yeah, that I do not. Yeah, that's why I'm just here to listen. Yeah.
Right. Well, and that's why we're sitting here discussing it, because obviously we have to follow a statute, and that's all that we can go by and what's included within that statute.
Yeah.
And I did not see ambulances that belong to a special district.
Do you have that number of that statute?
It's 30-11-107.9.
Thank you.
Yep.
So if anybody has insomnia, if you want to start reading a bunch of statutes, just grab a book, and trust me, you will go to sleep in a hurry. So, like I said, just to bring you guys up to speed, is that's kind of, I think, where we are leaning. It's just a matter now of, we had actually presented it originally, our talk and our discussion was around 1.9, but we have to see for sure what it's going to cost us to take care of our law enforcement, our DA, everything, and incorporate that to see, the pie is this big, and whether we cut it into 6 pieces or 8 pieces, still the same pie. So I know where you're trying to get, and we would love to help you if we can, but we have to actually figure out what our needs are first, and then we can, really establish those numbers of what it needs to be. But unless I'm wrong, I think we've kind of made up our mind for the PSST instead of a general sales tax, because I think general sales taxes fail because it goes in the general fund, and there's too much flexibility. Well, everybody wants to know where their money is being spent. That's a fair question, and I think that they deserve an answer. So this way, we can establish what it is, the percentages, and then it's specifically delineated to, it's going to go to A, B, C, D. So.
I believe the last time that we had this conversation, you asked about our interest in helping promote this, and I think you can, from the Cortez Fire District, we can guarantee 100% support in getting boots on the ground, and talk to people and hand out flyers and do whatever is necessary to support across the board whoever, can be part of this PSST opportunity, so.
I would caution you greatly, because you cannot spend taxpayer dollars to support or oppose a tax initiative.
No, I know.
That includes printing out one little sheet of paper on a copier in your station.
No, yeah, I know, I realize that, yes, sir. No, I'm aware of that. And it couldn't be done while we're on duty. No, we know that it's off duty. I mean, I'm on duty all the time, so I've got to be cautious with that. But our folks have said, yeah, off-duty time and.
But you can have a group on their own time.
Promoting. Oh, yeah, absolutely.
Yeah.
No, yeah, we're very cognizant of those requirements and restrictions. Yes, sir.
Okay. Perfect. Good job. I was gonna, perfect, thank you. So, we do have, when we have to have the language, and if I can pull that email up, but I want to say it was in July or August, correct? For the language for the ballot? Do you remember that?
The language for the ballot. Oh, when is it due?
Yeah.
Yeah, I think it's due late August, early September, right around then.
Yeah, so
Yep.
we'll have that established. That'll be kind of within our purview. But the education component, I think, needs to start rapidly. So how quick, from the 4 of you, could you even, and you don't have to answer today because it's kind of a it's a time frame. When could you be ready to bring, to start an education piece? And the reason I ask that is because we get asked almost weekly, or we're told almost weekly, that we have a sales tax, and we're correcting people all the time. No, we don't. No, we don't. No, we don't. So people don't understand the difference between a property tax and a sales tax.
Well, and Commissioner, I think that a critical piece is going to be getting hard budget numbers from these
Yeah,
organizations.
that's what I was going to ask for. is What would it take for Mike and Tony to get?
Until we have a
those
resolution and a budget question
positions filled?
that's going to give exactly what the tax is and where it's going to go, I mean, it's going to be tough to do public education because we're talking kind of pretty broadly. But once we get the numbers, then we can really
Okay,
set
so
what the rate's
the question
gonna be.
now, let me rephrase it, is when can you give us the numbers and when can you start? So now it's two questions instead of one. I think Cortez Fire Protection District has already brought that to us.
Yeah, our numbers would be real easy to put together, because we just did our budget not long ago, so I can get those within a month.
Okay.
We have a chiefs meeting next month, would be a good time for us to get a game plan together too.
Okay.
I'm just trying to think of dates. So we could probably have some numbers within a month and a half or so.
So I guess, I'm looking, we're in the middle of March right now, a month and a half. I think
It's
we're going to
May.
run out of time for our education component of what I think that we need to do. So I'm going to ask, is there any way that you could have it within a 3-week period of time and we start moving forward?
Yeah, we can. Gonna work on it.
Okay. Because it needs to be real numbers. We're going to want the people in Dolores's district, Mancos's district, Pleasantview's district. We've got to educate everybody. So we've got to hit all the 5 boroughs that we're out there dealing with. Obviously, ours is going to be the law enforcement component with the sheriff, which we can get that done, and he's working on numbers for us right now. So I would say 3 weeks. I'm not going to give you as much time as you want. I think we're going to run out of time. And that's just being realistic, guys.
I think it's critical that we have these numbers. If we don't have these numbers as to where we're at.
Well, and I think that the sooner we can get numbers and the sooner we can get our resolution passed, and then we've got a ballot question, this is what we're looking for, and we can get out there and educate.
So you might get a month and a half to educate, to start educating, but the numbers we have to have right away. Okay? Any other questions for us? Get together? Thank you. All right.
Thank you all for coming.
Sheriff, do you have anything you want to add to either of those two conversations? Okay.
You gave me a week phone silence, so.
We did.
We're good. Okay, thanks.
Thanks, Steve.
Okay. Well, Shaq, we only have one more thing here, the continuing sales tax budget cuts discussion item.
And that'll probably be an ongoing agenda item for the foreseeable future.
So I met with Shaq last week. I met with, Shaq Fader and I met last week. I gave him, we kind of went through every line item. We went through our last audit that we have, which obviously we're going to have another audit coming up and it'll probably be done, but we won't get it before June. Typically, so
It'll be
we're-
July.
So we're still using the numbers, and out of the 21 audit. So there were some questions that I had asked Shaq as we were looking through all of these. So Shaq, do you have answers for the questions that we had established?
Yep. Yeah. Which page do you want to start on?
We can, let's start at page 52. So, looking at this fund,
This is the public health.
sorry,
fund.
that's public health, that shows their surplus. The conservation, I'm trying to find it now, Shaq. My notes were on.
Conservation Trust is 53.
Okay, so go to the contingency fund, page 60. So let me stop and back this up just for a minute. So we basically are trying to look for $3 million to get back to where we were at. For
To
the budget.
have revenues and expenditures equaling each other.
Equal, because right now we have more expenditures, not enough revenue. So, we started looking at these funds. When I looked at this fund, and I was looking at it with Phaedra, and then questions for you, Ian, is the contingency fund, we have almost $600,000 in there. We haven't touched that fund at all that we can see for the last 2 to 3 years.
And so the attorney and I looked at this together, and by statute, the contingency fund, so the contingency fund cannot be used unless it's something that could not be reasonably foreseen. So by definition, if we budget to use it in 2023, then it's ineligible for the use. Do you concur with that?
Yeah, I think that's accurate. That contingency fund really talks about acts of God, so natural disasters, those sorts of things. Now, whether Kinder Morgan pulling back could be reasonably foreseen, I mean, I suppose that's debatable, but I don't think that the statute contemplates using the contingency fund for something like.
So as far as the statute then, because I couldn't find anything, what is the amount that has to be in the contingency fund?
It doesn't say. It says the Board of County Commissioners is authorized to establish a contingent fund to provide for expenditures caused by an act of God or the public enemy or some contingency that could not have been reasonably foreseen at the time of the adoption of the budget.
Could one argue that inflation is a public enemy? No, don't start that.
Does this, if you use a contingency, does it have to be brought back up in a certain length of time?
It also
Does it
does
have to
not
be
give
replaced?
guidance on that.
Okay.
No, the contingency funds is something that we can establish to cover these sort of unforeseen circumstances. And I think, I think the problem we run into, what's foreseen at the time that we adopt our budget. And I think at this point, I mean, we sort of.
And it does specifically say unforeseen at the time the budget is adopted.
That's where I would be concerned. I mean,
Okay.
at the time we adopt the budget, we know that this is coming, and so my recommendation would be to stay away from that contingent
Okay.
fund.
When we had our conversation, we were only looking at $100,000 out of that anyway. We were just trying to
Yeah.
chop away
Yeah.
at every fund to figure out how to come up with that money. So, but we didn't have a statute in front of us. Going back to page 59.
So page 59.
This is the emergency reserve fund.
And so there's a couple of things I found in the statute on this, Chairman. And one is that in order to get any money out of that fund, the commission has to declare an emergency.
Which we did. But
Yes,
it has to
and you've
be
also,
Post,
yeah.
we are post the emergency declaration.
Yeah, we've already ended the emergency declaration. Well, we are in an emergency declaration for the drought, so in theory, you could use, under this, you could use it to help offset free out-of-fight removal or compost production, because we are in an emergency for the drought. Would that sound accurate, Ian? We do have an ongoing declared emergency.
I haven't
for
looked
that.
at this statute per se, Shaq, and so I'm going to need some time to do that. I didn't realize that we were going to discuss this fund today.
Yeah,
And
so I can,
And we don't have to go into this step today. I mean, Ian, if you need to look at some more of these statutes, because
Yeah, I mean,
it's all weird.
I guess if you guys can give me just a list of what it is you're looking at, then I can look at the statute. Shaq brought up the emergency contingent fund. and
We're
I
looking
did
at
look at that.
everything.
and I did look this one up, and you do have to have a declared emergency to touch this fund. Also, that fund is supposed to contain a balance equal to 3% of expenditures. It does not say if it's just general fund expenditures or countywide expenditures. However, this would not be, the balance in there is not 3% of countywide expenditures. It's more than 3% of general fund expenditures.
Well, I would think it would be the general fund, because those other are outside.
I would
revenues
think
that
it
are
would be
coming
to
in
general
that
and
pay
road and
for it.
bridge, since that's where our mill levies are. So,
But even if we did make those two cuts, it's just a one-time fix, isn't it?
correct.
It doesn't keep us going the year following.
Correct, but I think our discussion last week is we were talking about have we used every penny that we have that's actually, that we can use?
Right.
Yeah,
Because there
I
are
think what
pots
the
that we
chairman
can't-
had brought up in his meeting with me was, could we take, say the deficit is 3 million, we're spending 3 million more than we're taking in. And I do want to remind people that we are hoping at some point Kinder Morgan does bounce back some. But we do have a healthy reserve right now. On a long enough timeline, if we continue to spend more than we're taking in, we'll blow through that reserve, but we do have a healthy reserve. So what the chairman had suggested was, can we make up half the difference from the reserve and then, do the other half in cuts rather than trying to cut 3 million out of the budget at one time? And
So-
correct me if I'm misstated that.
No, that, I actually found my other set of notes now, and that's exactly what we were talking about. So if we use a portion of that reserve, which reserves are there for a reason, because now we have an issue that we have to use them. If we take 50%, just like Shaq said, and we get 1.5 million, and then we cut the other 1.5 million within the budget, and that's why we had talked about, let's look at every line item that we have that we can use. So that's why this fund came up, Ian, and I, yeah, you can have some more time, because we're in March right now, and this is gonna be a
Ongoing
this is
until
an
September.
ongoing discussion for quite a while.
So are these the two funds, or were there additional funds that you guys were looking at? I mean, I guess I can just look through the budget and see what's in there and.
Those were
figure
the
it out,
only
but-
special funds we considered tapping, or that the chairman wanted to look at tapping into.
So we looked at those. There are some other things that we looked at. One of them, we had talked about, and I don't have that in front of me, but in our budget, we have, I want to say, just under $200,000 for cleaning. We felt
185,000, give or
if we
take.
could maybe cut that in half and only, and these are just ideas that, I mean, we're just thinking, every $100,000 cut we can get adds to that 1.5 million, which means that, maybe only we get services twice a week instead of every day. It's just a thought, just an idea.
I'll find the statute for the emergency reserve fund and get you guys a synopsis of that.
Okay.
It sounds like Shaq's already looked at it, but I'll look at it as well. My take is that contingent fund, we can't tap into that for this sort of thing.
Right? And that's my question is, what does the statute say has to be there, and are we there, are we not there?
Yeah, so the contingent fund, like I said, it doesn't have an amount that has to be there. This is something that we can set up, and then we don't have to set it up. It doesn't set forth parameters in terms of how much we have to put in there, how little we have to put in there. It's something that we can set up, and then we can access it in an emergency that wasn't anticipated at the time of the adoption of the budget.
Okay.
And then, Chairman, you had asked me how much we spend on dues, training, and travel. Countywide, the amount is $237,385 is budgeted for dues, training, and travel.
So that
And
goes
that
to
does
every
include-
department, but before, I thought we started looking at every department, we looked at every other line item that we have to see what are the cuts that we can make before we start going out to all the people. Although this is dues, travel, and training, we could probably cut a percentage of that also and not really hurt too many.
And I do want to make the commissioners aware that 20% of that is the commissioners. You have a $50,000 dues, training, and travel line item.
Correct, because we have the most dues.
Because you're going to DC and Denver and wherever. But, so you got to be real careful when you make those cuts in your own budget. While there's certainly a lot of things that can be done virtually now, I think it's also important that you not lose the county seat at the table when you need to be advocating on certain issues.
So that was one that we talked about. And then obviously, lastly, we can talk about the mills when we reset the mills every year too, as we start moving into our budget process. So that's just food for thought. It's not anything we need to discuss right now at all. It's just really food for thought for you guys. And if you don't have a copy of the 2021 audit,
I've got one.
we can get you one, but what I've been doing now is just going through every line item and trying to figure out, is this possible? Is it legal? I mean,
That's
where
a
can we?
good point.
Because we can't just rob from Peter to pay Paul. It doesn't work that way. If it's in there for one reason, it's got to stay there, so.
And, the other thing that is always on the table is increasing fees, but really the only place you have any latitude to increase fees is at the landfill, which then you can't transfer to the general fund.
I did, Shaq and I did discuss the fees for the jail, and I know the sheriff left, but we'll catch him tomorrow. The $75 that we are charging right now, I don't see how that can even be covering our fees.
It's not.
So I think that's something that we could raise immediately. And we can do that at any time, the way I understand that in the past, because we have the ability to get our fees per day of what it's costing us.
And I hate to rub salt in the wound, but I want to remind the commission that the state is not currently paying even as high as we have the rates set.
And so the fees that are set by the state are more difficult, because when we talk about DOC holds and parole holds, we have less ability to
Correct.
raise
We do
fees.
not have to accept the DOC holds.
We don't have to accept the parole holds.
Or the,
Yep, the DOC holds we do have to accept, and that's kind of one of those unfunded mandate kind of things. We can negotiate with them to try to get a higher rate, but they don't necessarily have to give it to us. That's set up at the legislative level. They say this is how much we're going to pay per day, and then what the statute says is each individual county can negotiate a higher rate.
so then we need to start negotiating a higher rate, because our costs are absolutely inflated.
We can certainly reach out.
And we did that, I want to say, in 2019, we reached out. I want to say John did that? You
I-
follow up with him?
Yeah, I wasn't involved in that call. I do know that conversation, I think, did take place, and my understanding was that there wasn't a lot of budge from the state level. I mean, it's certainly a conversation I'm happy to have again. You know, it's certainly worth a try.
Well, I think we have to reach out and continually try, because we're not at 56.75 or whatever it is, $58. We're way under, it's the cheapest motel in town.
Yep.
And I mean, they're getting fed, and we're housing them, and it's costing us much more than that. So that's one place that we can actually use for revenue. Obviously, the landfill is just revenue to the landfill, so it doesn't do anything for us in the
Yeah, it
general
would be
budget, because
illegal
it's
to
a-
use that in the general fund.
It's an enterprise fund, so that one doesn't much matter. So those were some of the things that we looked at immediately, so I'm going to challenge you guys to, I guess, look
Well,
at.
and before our next department head meeting, I'd like direction from the whole commission, whether you agree to take another $1.5 million out of reserves and cut $1.5 million, or if you want to cut the $3 million. I kind of need direction from the whole commission on that. I don't need a vote or a motion, obviously, but it would be good if you were all in agreement on how you wanted to do that.
You can think about it. You don't have to answer it now. When we started talking, like I said in our meeting the other day,
I
it's
thought
like,
it
well,
crossed my mind for next year.
what's fair? And we just said, okay, well, let's try and do it.
Split
50,
the
50.
difference.
And then hopefully, towards the end of next year, Kinder Morgan's production is through the roof, and
I don't think that's gonna happen with this
Administration, I don't
this
either.
administration. Till this administration goes away, that's not going to happen.
I would like to sit here and argue with you, but I got
I think that's
nothing.
gonna happen with this administration in there. With their attitude toward natural resources, I don't think that's gonna happen. I mean, to be honest with you, I just don't think it's gonna happen.
Well, I'd like to sit here and argue with you, but I got nothing.
They better figure out where they're gonna get electricity, because it can't be generated or produced overnight.
Well, I think the
or
first step is to
transmitted.
shut down all the coal generators.
Anyway, we have to plan for what we're looking at today, not what might happen.
Right.
And there again, that's the whole purpose of the public safety sales tax. Then we can actually look long range, but right now we're gonna have to look. So that's why we kind of established, we will still be fine out of the reserve if we only do the 1.5, but you don't have to decide on that right now.
Right, I just would like direction before our next department head meeting, which is gonna be in April
How's this?
3rd, maybe, 2nd? I can't see the point at them.
Yeah.
And then if you'll look at those other funds to see if we can or cannot move any of that money.
I can.
And I've got the other statute printed off on my desk already, so.
Perfect. Okay, any other questions, Shaq, or?
No, I just need direction from the commission on which way we're gonna go, and we discussed the funds that we could possibly tap into. For our drought mitigating efforts, we could, since we have a declared emergency for the drought, offset some of those, but I don't know, we're talking about next year, and I don't know that we will still have that emergency declared. It is likely, unfortunately, but that's certainly an option. And then for the Conservation Trust Fund, Phaedra and I did reach out to the state, and anybody we have doing maintenance at the fairgrounds, for the time they spend out there, we can offset part of their salaries and benefits. So when the maintenance crew is out there, or when the noxious weed department is spraying weeds, or if Rob's crew is delivering gravel or whatever, we can charge that part of their salaries and benefits to CTF. It'll help. It's not going to make a huge dent.
We could always go back to issuing warrants.
This guy.
Hey, it's been done in the past.
Okay, we'll, obviously, I'll keep working with the staff to see what other things we can cut, and it's just part of a long process this year. Okay. Very good. If there's nothing else, we'll adjourn.
Okay.
Okay, thank you, guys.